So the ocular associations. So this is the ocular associations that I was talking about. There are several conditions in the eye itself that are associated with keratoconus. The most commonly noted are vernal keratoconjunctivitis, with which, like I just mentioned, there will be constant eye rubbing, and the picture above here shows you these giant papillae. These are papillae which is typically seen in patients with vernal conjunctivitis. Although all papillae are not as big as what we see in this picture, smaller papillae can be present in almost all patients with vernal keratoconjunctivitis. And papillae, if we may recall, are areas where there is hyperplastic conjunctival epithelium, and this papillae are particularly indicative of allergic disease. Blue sclera is another ocular association noted in a large number of patients, and blue sclera is particularly associated with osteogenesis imperfecta. Osteogenesis imperfecta is a systemic disease, and whenever we see a patient with blue sclera, we have to always look for systemic associations to rule out any bony problem as well in the patient. Aniridia indicates absence of iris associated with keratoconus. Leber's congenital amaurosis is a condition which patients can have a pigmentary retinopathy-like picture. It is typically seen in very young babies, and usually the babies have roving eye movements. That is, their visual prognosis is very poor. They can hardly, they are almost blind at birth, and these babies have, apart from pigmentary retinopathy like picture of the macula and the retina, they also have other problems such as nystagmus. So treatment of Leber's congenital amaurosis is very difficult, but it has been found to have a definite association with keratoconus, because these babies have typically what you call an eye poking sign. That is, they constantly use their finger or their digits to press upon the eyeball, and that is believed to cause some alterations in the corneal curvature and hence predispose them to keratoconus. Retinitis pigmentosa, what we are seeing in this picture is retinitis pigmentosa. So you can see the bony, all these black spots that we are seeing are the bony corpuscles. This is the vein, and the artery is hardly visible. Artery is supposed to go alongside the vein, but it's hardly visible, and that is one of the features of retinitis pigmentosa, where there is characteristically arterial attenuation. So retinitis pigmentosa is characterized by a triad of three things. One is the bony spicules, bone corpuscles it's called. That's what you're seeing in this picture. All these are bone corpuscles. Then the second one is arterial attenuation. Arterial attenuation is the thin thread-like arteries. It is not visible even in this patient. And the third thing occurs is optic atrophy. Optic atrophy in patients with retinitis pigmentosa is called the consecutive optic atrophy. It has a typical word which is called consecutive optic atrophy. Floppy eyelid syndrome in these patients, keratoconus is again an association, because these patients also have the tendency to rub their eyes. The tarsus in these patients allows for the eye to evert very easily, resulting in papillary conjunctivitis, and any cause for that matter of persistent eye rubbing can predispose a patient to keratoconus. So among the systemic associations, we have some definite diseases. Systemic associations commonly are Down syndrome, Marfan syndrome, Ehlers-Danlos syndrome, osteogenesis imperfecta, and atopic dermatitis. So these are the 5 very frequently associated features, causes of keratoconus. So Down syndrome is typically seen in children, where they have delayed milestones, and in the eye we also have, on ocular examination, we have nasolacrimal duct obstruction. Many of them have abnormalities with the eyelids, and they have brush field spots. On examination eye you can have brush field spots, and apart from that, keratoconus is one of the other associations. Marfan syndrome and another connective tissue disease. The picture here shows you a patient with Marfan syndrome. Long digits, which is called arachnodactyly, is one of the characteristic features of Marfan syndrome. Apart from these patients can have ectopia lentis. Another feature these patients can have is they predispose to retinal detachment, and many of them can be myopic patients. So all these are features of Marfan syndrome, and along with this, these patients can also have keratoconus. Ehlers-Danlos syndrome. Ehlers-Danlos syndrome, again a connective tissue disease, and Ehlers-Danlos syndrome also can predispose to retinal detachment, and these patients can also have angioid streaks. Angioid streaks are seen in the retina, where they appear like ruptures in the retinal surface, and angioid streaks, to detect angioid streaks we need to do a fundus examination. Osteogenesis imperfecta is typically what you're seeing in this picture, the blue sclera that you see. This bluish discoloration can occur in another condition as well, which is called scleritis. And in anterior scleritis, due to recurrent attacks, the patient can have this slate grey appearance or a bluish appearance. But what is more typical of a blue sclera is osteogenesis imperfecta. And atopic dermatitis is also one of the predisposing causes of keratoconus.